Dr. Corey Burt here. Hey, I'm excited to be here with you for the next 60 minutes. Today's course is called Unraveling Upper Cervical Anatomy, Biomechanics, and Neurology. Of course, the purpose of this 1 hour course is to do a deep dive into the anatomical, biomechanical, and neurological details of the cranio-cervical junction. And ultimately, so you feel more confident when treating and managing your patients who've suffered trauma to this region, the head and the neck. And based on my experience teaching this content to several massage therapists, personal trainers, medical doctors, I can guarantee you will learn something new and interesting from this, especially as massage therapists, because you all already have such a great foundational understanding of anatomy, biomechanics, and neurology. So today I'm just hoping to add to that understanding. Now, I'm going to quickly introduce myself. I'm an upper cervical NUCA chiropractor that specializes in correcting acute and chronic neck injuries. And whether that's a macro injury such as a car accident or micro injuries such as ongoing sports concussions or even computer desk work, these can all compromise the health of the brain and the nervous system, leading to a whole lot of future health problems. And I'm telling you, the upper cervical spine is the most overlooked region of the entire body when evaluating someone for chronic muscle imbalances. So we never want to take this lightly. All right, we've got a lot of info to get through, so roll up your sleeves. Fortunately, you can pause and rewind if you miss something. Remember, you need to pass the 10-question quiz at the end with a 70% to get your CE, 1 hour CE credits. And of course, if you at any point in time, if you ever have any questions about the content or about a case, please send me an email, drburt@eliteuc.com. Of course, I'm always here as a referral source here in Tigard, Oregon, just off I-5. So if you ever feel like you are stuck on a challenging case, or you know someone who can benefit from an upper cervical care, well, I'm here to help. And so let's get started finishing out with this intro. What we're going to start by doing is discussing the two most important parts of the body. I'll cover the anatomy of the upper cervical spine, hard tissue, soft tissue, movement biomechanics. This is all really important to discuss, especially with the upper spine, upper cervical spine, because there's no other area in your spine that is complex as where the head meets the neck. And then most interestingly, we will do an extreme deep dive into the neurology of the upper cervical spine, really unraveling how head and neck trauma is going to influence this neurology, which will in turn result in chronic muscle imbalances and many other named spinal conditions if the injury is not accounted for and corrected as it occurs. Then lastly, I will teach all of you a basic assessment protocol that I use personally every day in my clinic to determine if someone has a problem or a misalignment in the upper cervical spine. And this is a basic screening, but it's really simple, really valuable. You can learn it in 7 minutes and less. You can complete it in 7 minutes and less. And if you want, you can immediately implement this into your new patient routine. And so that'll be really exciting. But yep, that's all I got for this one. I look forward to seeing you on the next video.